Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison, and we are back with another mini-sode all about antibiotics.
Woo,
of all the things, of how they are appropriate to use in some situations, and what to do with when you have to give them to little kids and adults, and kind of let's get into antibiotics.
Yes, antibiotics. I like how you said that.
Antibiotics.
So kind of piggybacking off of our last little mini-sode, actually, something that is our last little tidbit that we talked about was that I love to cherry pick, right? I love to cherry pick in medicine. I sometimes use conventional medicine, sometimes natural agents, homeopathy, whatever it might be. And there are times where patients will, let's say a kid has strep or something and they go to an urgent care. Strep throat. Yes, strep throat.
Not strep B.
Yes, strep throat. And they go to an urgent care and they're diagnosed, and then they'll call our office because they're a patient of ours, and they're like, hey, I was just diagnosed with strep, or my kid was just diagnosed with strep. What else can I do? Like, I'm going to give this antibiotic. Is there anything else that I can do? And so there's lots of little points in here, but the biggest point is that sometimes antibiotics are needed. And sometimes I'll actually choose to use an antibiotic in certain more chronic treatments in functional medicine, but I'm very picky with what antibiotic it is and dosing, and it's never every single day, and it's pulsing. And that's a little bit different of a conversation. But when there's an acute issue and you or your kid has to go on antibiotics, what can we do in that instance to protect ourselves? Because antibiotics are wonderful at attacking and killing what they are designed to, right? If we have strep throat or whatever it might be. But we all know that they also tend to destroy our good bacteria within our GI tract. And so whenever an antibiotic is needed, if it's for you or for your kid, we want to protect our gut health. It is awesome if you know it's coming. Like, let's say you're going to have to take a prophylactic antibiotic for a surgery.
Right.
Then start a couple weeks beforehand. In most cases, we don't know that we're going to be taking an antibiotic, right? If we're acutely ill or something, we go to an urgent care and we get that antibiotic, then fine. Start the day that you are taking that antibiotic. And I always recommend doubling up on probiotics. What?
That never made sense to me.
Why?
It just, because one, I was on heavy doses.
We're talking about acute strep throat, not doxycycline for 6 months.
I know, but it didn't make sense to me of why. Okay, I want the antibiotic to do what it needs to do. In my brain, it never made sense to do a probiotic and a prebiotic at the same time I was doing. I don't know. It just never, in my Swiss cheese brain, it was like, okay, well, let the antibiotic do what it needs to do, and then I'll go back to the prebiotic and probiotic.
But your probiotic doesn't interfere with what that antibiotic needs to do.
I didn't know that at the time.
No.
So good to know. Take it all.
Yeah, because it's kind of apples and oranges. You're taking that. So, okay, let's stick with strep, not chronic Lyme.
Yes.
Because it's just easier to explain. When you're taking that antibiotic for strep throat, that antibiotic is designed to kill that streptococcus, that strain of that bacteria, right? That is targeting your throat and causing you to have all those symptoms. Right. Taking a probiotic will not interfere with that guy killing off that strep.
And it won't kill off the
whatsoever.
probiotic that I'm putting in. So that was my
Timing matters. Yeah,
okay.
so you don't want to take them together.
Okay.
Yes, timing matters. Where, yeah, it is weird to take a probiotic and an antibiotic at the same time.
Okay.
We want to space it out, but if you, it's more about trying to mitigate the good bacteria that's also being destroyed
Okay.
and kind of creating like a little brick wall that says, okay, antibiotic, you're coming in to kill your targeted species, which is wonderful in that acute instance. But in doing so, you also can be killing off our other flowers in our
Right.
GI
We
tract.
want to get rid of the weeds, not the flowers.
Exactly.
Okay.
But that antibiotic can't differentiate that. And so by giving the probiotic, you're feeding the flowers, but you're not interfering with killing the weed.
Gotcha.
Make a little bit more
It
sense?
does.
Okay.
And that was never explained to me.
Yeah. So I like to, when I say double up, I like to do kind of your normal good probiotic strain depending on the patient, depending on what you can handle. This is very, very different,
Mhm.
right? Between kids and adults. And then if you're talking more about a killing, like adding a probiotic killing agent to
Mhm.
kind of just help if it's a bacterial infection or whatever might be going on, then I like adding in a spore-based probiotic.
Okay.
So something like Restore Flora or Megaspore-Biotic by Microbiome Labs. Those spore-based probiotics, they're stronger and they release spores to that can withstand the acidity of the stomach and get through to the small intestine where they release those endotoxins. And so those spore-based probiotics are a little bit at killing off the bad bacteria,
Okay.
whereas normal probiotics come in and fuel our flowers. They
Okay.
help to diversify our good bacteria. So I kind of like to do a little bit of both depending on the age, depending on the infection and what's going on. But that's a good way to just protect your GI tract specifically
Mhm.
without interfering with what the antibiotic is going to be doing.
Good to know.
The other, yes,
I don't think I ever got a probiotic growing up.
I didn't either. Yeah, no,
I
I
don't think
could have
that
used
was
one,
I don't
but
think that was a thing. So it was always that pink
oh,
yummy.
yes,
Yum.
so good. So
I think
good.
my mom had to hide it because I
You
was
would
taking
just
extra
chug it.
dose.
Oh my
Well, I wanted I
gosh.
because I like the way it tasted for whatever weird reason. But
I
yeah,
think a lot of kids did, to be honest.
and it was pink.
Yeah.
So
Fun little event for the day, pink
yeah.
drink. Um, the other aspect to taking that antibiotic is especially, and I mean, my patient population tend to be a little bit immunocompromised. And
Mhm.
so when we have something like candida is a normal part of gut flora. Like there is a little bit of candida. It just shouldn't be overgrowing and
Right.
it's very, very opportunistic. So if you have that antibiotic come in, do its job for an acute illness, awesome, wonderful, we love that. But if it is reducing the good bacteria that help to keep the opportunistic things at bay,
Yep.
now we also want to keep those opportunistic things sitting down.
Right.
Candida is a big one, especially for patients who have to be on longer doses or regimens of antibiotics. So I always like to intermix then something for Candida.
Okay.
This also can look very different for depending on the age and depending on the patient. You could do some good old fashioned biocidin, which is a natural kind of herbal extract, or I wouldn't really call it a tincture. I'd call it more of an extract because it mixes a bunch of different things together. But that is good for helping keep the bad boys at bay, including a
Okay.
little bit of candida. You can do good old fashioned nystatin. I always prefer to compound it because it's cleaner.
Yep.
It's just a fatty acid when it's compounded, no yuckies to it. Caprylic acid, oil of oregano, even just some extra MCT oil if you're a
Mhm.
smoothie person, putting extra MCT oil in your smoothies or whatever twice a day
Yeah.
can help keep that candida at bay as well. The third thing, so probiotic, double up on probiotics,
Okay.
keep candida at bay with anything we kind of just mentioned. And then I always love immunoglobulins. Immunoglobulins, not to be confused with colostrum, but the one brand, everyone knows the brand that I love, is Mega IgG by Microbiome Labs. It's truly, colostrum is a gooey goodness that when we breastfeed,
Mhm.
that's what we
Yep.
give baby, right? And the reason it's so good is because it's filled with all these amazing antibodies that help protect baby. So colostrum in a supplement is just that, but they take it from a cow. But colostrum contains dairy. So I like to go a step further and just do the immunoglobulins. Immunoglobulins are those good antibodies that are taken
Right.
from the colostrum, but it doesn't contain the dairy component. So a lot of my patients just can't handle dairy. So hey, that's
We
honestly
got
the
enough
reason
going
why.
on.
Yeah, that's honestly the reason why I use it. But it comes in and it coats the inner lining of the GI tract. One, it's really, really awesome for immune function. So if you're acutely ill and you need that
Mhm.
antibiotic, then it's helping our immune system and our immune function better while we're acutely ill. But it's also lining
Right.
the inner GI tract to help protect the gut.
Okay.
So I love those three. If we know antibiotics are coming, we can start a week or two beforehand, depending on how long the course is. Then I like to keep going for like 3-4 weeks afterwards. If it's a super short dose, like like a Z-Pack or something,
Yeah.
no, you don't need to be that dramatic. But if it's a 10-day course or a 14-day course, then I really like to extend it about 3 or 4 weeks
Okay.
past that antibiotic use.
So we did talk about timing. So
Mm-hmm.
what about timing? So if we have to go on an antibiotic and we get to take all of these extra yummy good things, how do we separate those on timing?
So let's say the antibiotic is twice a day. What I would do is I would take your antibiotic in the morning. I would take your first probiotic like at lunch.
Mm-hmm.
And then I would usually your antibiotic is breakfast and dinner, right? Like with food.
Yeah.
Um, take your second antibiotic, and then right before bed, you take your spore-based probiotic.
Okay.
Or if it's someone who we know can't handle a spore-based probiotic, I like to take just a differing probiotic, so something with differing strains
Yep.
than the one you took in the morning, and take that one right before bed.
Okay.
Those two you want to space out. The other guys, it's total. Well, I should clarify. The Mega IgG could be taken anytime in the day.
Okay.
The only stipulation, if you are taking something for candida, the only stipulation is if you choose to take something like nystatin.
Mm-hmm.
Nystatin should not be given around the same time as the spore-based probiotic
Okay.
because they kind of there's no contraindication, but they just interfere with each other a little bit.
Okay.
Otherwise, if you're just doing like oil of oregano or caprylic acid or MCT oil or whatever it might be, like something more natural, you
Yeah.
can take that guy whenever.
Okay. Oil of oregano.
Ooh, can you the
I
burps?
burp it.
The burps that come with oil of
That
oregano.
and holy basil.
Oi, I know. I
So
know.
if you're gonna do those, make sure that you take it. Give your time.
Yes.
Give it time to settle before you lay down. Because if you lay down
Ooh,
too soon,
those are nasty burps.
it hurt. It kind of hurt.
Yeah, those are yucky burps. So there's a time and a place for everything.
Yeah.
There antibiotics are needed sometimes, but just know that even if you have to, because I get a lot of parents who are like, oh, I had to give my kid this antibiotic and I really didn't want to. But instead of thinking like that, we can think, okay, hey, this antibiotic comes in, it does its job, it does its purpose, but here's what we can do for you to not feel that like, oh, darn it, I didn't want to use it because I know what it can do over here. Okay, so let's protect that.
Okay.
You know?
Perfect. So we're supporting while we're letting the antibiotics
Exactly.
go to
And
war.
I'll also help patients triage because antibiotics, we all know this, are handed out like candy. So in that acute illness, I mean, like 90% of ear infections are viral.
Mm-hmm.
So I'd rather if the patient went to urgent care, they got that antibiotic or whatever, I will give a patient a line and say, hey, garlic mullein oil and X, Y, and Z for the next 24, 48 hours. Come in, let me see your ear, and then fill the script, but let's give it another 24 hours supporting it more on the viral front. 9 times out of 10, it goes away.
Right.
And they don't even need that antibiotic. So I try to serve as that for my patients too, as a fine line between, okay, hey, go ahead and take this right now. And this is how we're going to support.
Right.
Or do we really, really need it in this acute instance? And is there something else we can do on the natural front with a stipulation, with a time frame of, okay, I need to recheck you, I need to see you, and then I will always give you the green light if I'm like, hey, yeah, we need this here. I'll always tell my patients that as well. But 90% of the time, there is something you can do to avoid that antibiotic.
Right. Because antibiotics address the bacterial load, not the viral load.
Exactly. And so many things. I mean, so many urgent care doctors are just like, or practitioners, they're just giving antibiotics for whatever, and it's a viral infection.
Right. So know the difference. And maybe we should do a mini-sode on bacterial loads and viral loads and how to differentiate
manage.
and tell the difference.
Mhm.
Because I know that on the adult side of my chronic care, I was given a lot of things for bacterial things that I didn't need to do because it was a viral load.
Yeah.
And I did all of this damage for the long term of doing all of those things for a bacterial load that turned out to actually be viral, and that was not discussed for the first 7 years of me figuring out all of my
Yeah, so it can be
things.
on the chronic front and the acute front,
Right.
you know? Like, even if you have a cold that feels like it's turning more nasally and more sinus infection-y, how many times do you actually go to urgent care and they're swabbing and they're proving that it's a bacteria and then you're getting the antibiotic? No, they're like, "Okay, you have a sinus infection, here's an antibiotic," but then they are taking the swab and it comes back negative, and then they call you 3 days later and they're like, "Oh, you don't actually need that." You know? So it
Right.
happens on both fronts
Yeah.
a lot, but at least, yes, knowing the difference, and sometimes it can be hard, sometimes it's trial and error, but I'd rather give my patients the benefit of the doubt for the first 24, 48 hours. Again, depends on age, depends on severity of symptoms, there's so many variables there, but giving them that a little extra room, and then if you're not improving or worsening or there's certain symptoms that are popping up that will trigger me to be like, "Okay, nope, that like, you need to fill this now, you need to start this
Right.
now." But there's other times, most of the time, where it's not needed in the first place.
It's good to know.
Yeah. So great topic for next time.
Yeah. So we'll put it on the list for a mini-sode,
We
so
will.
stay tuned.
Yes, stay tuned, guys. We are continuing down our track here of mini-sodes. If you have any questions about anything we're talking about, or you have other topics in the future that we would like to talk about, hit up our website, and you can submit a form. Let us know. We love hearing from you guys. And until next time, let's discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.